Welcome to the presentation on Standards in Healthcare Information and Quality. This presentation will provide an overview of the SNOMED CT terminology and the ICD-10 CM-PCS classification system. First, we will cover content related to SNOMED CT. SNOMED CT, or the Systematized Nomenclature of Medicine clinical terms, is a comprehensive clinical healthcare terminology system used for storage and exchange of clinical health information. SNOMED CT is very broad in scope and representative of most domains applicable to clinical healthcare. It is also the most comprehensive international and multilingual reference terminology system. SNOMED CT was developed between 1999 and 2002 from a convergence of SNOMED reference terminology and National Health Service NHS Clinical Terms version 3 content for the purpose of combining strengths in basic sciences, laboratory, and specialty medicine, and highly granular clinician-focused content. SNOMED CT was developed as a standardized clinical terminology to meet the needs of clinicians and health information technology professionals for the collection, retrieval, aggregation, and reuse of standardized clinical data. It enables effective sharing, linking, and exchanging of synthesized health information. In 2005, the U.S. Department of Health and Human Services, through the Consolidated Health Informatics CHI initiative, adopted SNOMED CT as the designated terminology standard for interventions and procedures, Part B, non-laboratory, anatomy, diagnosis, problem lists, and nursing data. Further, the Meaningful Use Electronic Health Record Incentive Program, which started in 2011, required EHR implementation in accordance with the 2005 CHI initiative standards. As a result, SNOMED CT is now a required standard for electronic information exchanges, for vital signs, encounter diagnosis, and procedures during care transitions, discharges, and patient personal records. SNOMED CT is composed of concepts and the relationship of these concepts in 18 hierarchies. Every concept in SNOMED CT has at least one relationship to another concept, which characterizes concepts and gives them meaning or place. These relationships are hierarchical and spatial and must always be true. SNOMED CT contains the following structural elements. Concepts are defined clinical ideas. They range in granularity from general to specific. Over 300,000 currently active concepts. Some top-level or general concepts include clinical findings, procedures, drugs, specimens, events, and social context. Descriptions are human-readable terms with multiple synonyms, and they contain many descriptions to unique concept identifiers. And relationships, which there are subtype and supertype or parent-child relationships. They explain the hierarchical relationships, and every subtype is a part of a supertype that continues to wrap up progressively to a top-level hierarchy. There's also an attribute relationship, which explains spatial relationships and between two concepts of how they are logically related to each other. Multiple levels of granularity can be found within each top-level hierarchies. More aggregation ascending, more clinical detail descending. This figure provides a breakdown of each component of the hierarchy and a description of each. Here's an example of the concept of pain and how it fits into the structure of SNOMED CT as shown in the UMLS Terminology Services browser. The International Health Terminology Standards Development Organization, or IHTSDO, is a not-for-profit association that owns and maintains SNOMED CT. The IHTSDO has 22 national members, each having a national release center where SNOMED CT data files can be downloaded. Individuals residing within one of the national members can license and use SNOMED CT free of charge. The United States NRC is the National Library of Medicine. SNOMED CT is updated twice yearly in January and in July. The National Library of Medicine provides a SNOMED CT web browser designed for single-term, concept, or description searching. The NLM also offers a full SNOMED CT file download, complete with crosswalk maps between SNOMED CT concepts, text descriptors, ICD-9, ICD-10, LOINC, and RxNorm. Additional browsers can be found at the link included on this slide. ClinicClue is another application that is downloadable and useful for searching SNOMED CT terms. It can be accessed at the link included here. There are a variety of other resources available that relate to SNOMED CT. They are provided on this slide. We are now going to turn our attention to the ICD-10 CM-PCS classification systems. ICD-10 CM diagnosis codes are used by all providers who previously used ICD-9 CM diagnosis codes. The ICD-10 PCS procedure codes are used only for inpatient hospital procedures. The transition occurred because ICD-9 CM codes had limited data about patients' medical conditions and hospital inpatient procedures. ICD-9 CM was 30 years old, had outdated and obsolete terms, and was inconsistent with current medical practice. Transition to ICD-10 CM PCS was vital to transforming our nation's healthcare system and ensuring uninterrupted operations. ICD-10 CM and PCS has a completely different structure from ICD-9. ICD-10 CM PCS is more robust and descriptive with one-to-many matches in many instances. The expansion of the number of codes allows greater specificity and exactness in describing a patient's diagnosis and in classifying inpatient procedures. ICD-10 accommodates newly developed diagnoses and procedures, innovations, technology and treatment, performance-based payment systems, and more accurate billing. According to the Centers for Medicare and Medicaid Services, the transition to ICD-10, CM, and PCS was a major undertaking for providers, payers, and vendors. It has driven business and systems changes throughout the healthcare industry regardless of their size. The alphabetic index and tabular lists are very similar in format between ICD-10 versions 9 and 10. However, the alphabetic index and tabular lists are very similar in format. However, ICD-10 CM codes have expanded in field length from 3 to 5 digits in ICD-9 CM to 3 to 7 characters in ICD-10 CM, which provides more room for flexibility in code expansion and overall detail embedded within codes. The approximate growth of 55,000 more code options for ICD-10 CM provides for more specificity, including laterality, comorbidities, manifestation, etiology and causation, complications, localization, and so on. ICD-9 CM numeric code format was 3 characters plus a period plus two following characters. The ICD-10 CM PCS, the International Classification of Diseases 10th edition clinical modification or procedure coding system, consists of 2 parts. ICD-10 CM for diagnosis coding and ICD-10 PS for inpatient procedure coding. ICD-10 CM is for use in all U.S. healthcare settings. Diagnosis coding under ICD-10 CM uses 3 to 7 digits instead of the 3 to 5 digits used with ICD-9 CM, but the format of the code sets is similar. ICD-10 CM is alphanumeric, the first character always alpha and second character always numeric. ICD-9 CM was composed of 17 chapters within the classification system, while ICD-10 CM is composed of 21 chapters. A complete listing of all ICD-10 CM chapters is listed on this slide. Here is an illustration of the code structure of ICD-10 CM compared to ICD-9 CM, including the category, the etiology or anatomic site, and manifestation for both. For the ICD-9 CM code format has the category for the first 3 characters, the decimal point, followed by the etiology, anatomic site, or manifestation for the last 2 characters. In the ICD-10 CM code format, the first 3 characters represent the category, the next 3 are etiology, and anatomic site of severity, and then the last character is optional as an extension. ICD-10-PS is for use in U.S. inpatient hospital settings only. ICD-10-PCS uses 7 alphanumeric digits instead of the 3 or 4 numeric digits used under the ICD-9 procedure coding. Coding under ICD-10-PCS is much more specific and substantially different from ICD-9 procedure coding. ICD-10-PCS codes have expanded in field length from 3 to 4 numeric digits to 7 character and the approximate growth of 68,000 more procedure code options. ICD-10-PCS is composed of 16 sections. These sections are subdivided into 3 main sections: medical and surgical related sections, and ancillary sections. The key attributes of ICD-10-PCS include completeness, expandability, multi-axial, and standardized terminology. One of the largest differences between Volume 3 of ICD-9-CM and ICD-10-PCS is that the terms used to construct PCS codes are defined within the third character or root operation for the system. It is the coder's responsibility to determine what the documentation in the medical record equated to in the root operation index. The ICD-10-PCS classification system maintains a limited alphabetic index in which the main index term is the root operation, root procedure, or common procedure name. The main focus for ICD-10-PCS are the tables, where each code is constructed based on the first 3 characters, with the root operation, third character, as the axis of the code tables. It is not necessary to consult the index first before proceeding to the tables to complete the code. All ICD-10-PCS codes are 7 characters using both numbers and letters, with the exclusion of the letters I and O. The numbers 1 and 0 are used, however. Each of the 7 characters has a defined meaning, and the meanings change depending on the section. The first character of the code identifies the section of the code. A table indicating the structure of ICD-10-PCS is provided here. Here's another illustration of the code structure of ICD-10-PCS. The new code set was expected to produce a temporary increase in coding errors resulting in rejected claims. Medicare expected a spike in rejected claims 3 to 6 months following the introduction of the code set, peaking at 10% of all claims submitted. Productivity was anticipated to be directly affected because of the need to learn new codes and definitions. In 2014, the Centers for Medicare and Medicaid Services estimated a $9.7 million loss in coder productivity, an additional 1.7 minutes per code assigned. A variety of resources related to ICD-10-CM and PCS are listed on this slide. In conclusion, this presentation provided an overview of the SNOMED CT terminology, the ICD-10-CM classification, and the ICD-10-PCS classification.